Welcome to the Quiet Warrior Show, where we help top leaders find their pathway to incredible success and a lifetime of happiness. Here is your host, Tom Dutta, the Quiet Warrior.
All right, everybody. Welcome to the Quiet Warrior Show. It's Tom Dutta here. That's Dutta like butter. I'm your host for today, and I've got an incredible guest coming on, and she's in the green room. But I'd like to say a few things about her before I bring her on. You know, on the Quiet Warrior Show, we're live streaming, everybody. That means you're peeking into the studio of the taping of what will be a podcast and a YouTube video premiere. This one's very special to me. Let me tell you about Susan Landers, MD. She practiced full neonatology, the intensive care of critically ill, premature, and newborn infants while raising 3 children. And one of the reasons why this caught my attention is I realized that from my mom's stories, I was born premature, and so my radar went up. And secondly, she talks about the children that she saved and sometimes the ones they couldn't. And through my lifeline, we lost a little one to Down syndrome. So I really got into her book. We'll talk about that. She's worked in academic medicine on the faculty of 2 medical schools and in private practice for many years. She's worked for the American Academy of Pediatrics as an expert in breastfeeding medicine, writing policy and teaching at national conferences. She's been interviewed by many news outlets about her work using donor human milk in the NICU and her work with the Mother's Milk Bank of Austin. And she lives in Austin, Texas, and you're going to see in a minute that she has a pretty nice view from her temporary office. So welcome to the Quiet Warrior Show, Susan Landers.
Oh, thank you, Tom. It's such a pleasure to be here. You can see the beautiful live oak tree behind me.
I see that. And you know what? I had the pleasure of my show. I'm in Vancouver, British Columbia, Canada. You're in Austin. And I get to see a lot of people, and you never know what you're going to get. It's like a box of chocolates.
Good.
So, Susan, this is all about storytelling. I have read your book, and we're going to talk about that in detail, but I've pulled a lot of notes, and this is fascinating, the story to me. The first thing is that I want to acknowledge that you published a book by Morgan James Publishing out of New York. We have a common thread sharing the same publisher. When did that happen?
Yes. The book was published in September of this year, so just recently.
Fantastic. Hold it up there. Let's take a look at the cover. See if you can hold it up for us. Look at that beautiful cover. Everybody, the title, So Many Babies. Thank you, Susan. We'll tell everybody at the end how to get a hold of that. But the title itself caught my attention. And I sometimes on my shows, Susan, because it connects deeply, I dominate up front a little bit with a little narrative. And I want to do this to really honor your book and your story. I want to see your expression as I read this. And so everybody, let's get right into it. This is the opening, what I call the opening scene behind the curtain. And the big question that came out of this for me was why? Why would you go into a career like this? Let me read it. During lunch, I holed up in the neonatal conference room library and reviewed the outcomes of all babies born at 23 weeks gestation at our hospital in the prior 2 years, 1981 to 83. Only 2 of 12 such infants had survived, and those 2 had severe complications. They were expected to grow up with major developmental disabilities. I eagerly, and then she went on to say, later that evening, his nurse helped me turn off and disconnect the infusions. Now, this is a real situation unfolding, everybody. We carefully loosened the tape on his nose and upper lip, and I removed the breathing tube from this precious little boy, a fetus, really. I wrapped him in a soft blue blanket and handed him to his mother and father. His mom sat comfortably in a nearby rocking chair, surrounded by stuffed pillows, her feet propped on a low stool. Dad sat very close by. This was the first time she held him since birth. Mom lifted him up, wrapped him in his blanket for a kiss. Both Mom and Dad cried and spoke gently to him. I wish that I could remember his name. It was obvious that they loved and wanted him very much. There were no other family members available, so I asked if I could sit with them and was honored when they agreed. He seemed comfortable in their arms while his mother stroked his little hands and face. That evening, I sat there with that young couple, watching them hold their son, loving him and saying goodbye for 3 hours. It was heartbreaking. I kept thinking, what if this were my husband and me, would we be doing the same thing? Gradually, his weak breathing stopped, then his heart rate slowed, and finally his heart stopped beating and he died. Oh my goodness. I know this is emotional every time you hear, but hearing your own words, take us into the story. That moment in that room, and you spent a career saving little ones and unfortunately experiencing some of those setbacks. What was that like?
This was my first year on faculty at Baylor College of Medicine. I had been trained in neonatology, 3 long years of training after pediatric training. So I thought I knew plenty about saving tiny babies. It was 1983, before we had artificial surfactant, before we had very good means of artificial ventilation of these tiny babies. And this young couple approached me on day 2 of their baby's life and said, "We do not want this to go on. We have been told that the outcome will be horrible, or he will not survive. And we want to take him off the ventilator." And I said, "Really?" Because it was very unusual for parents to want this. I did the research. I talked to my senior partner who was on service with me. He discouraged me from doing this. He said, "This is not a good idea. You should tell the parents to press on." I took this case to the hospital ethics committee because I was so conflicted. Should I do what the parents wanted? Were they correct? It was their son. He was my patient. It was a rare set of parents who felt this way. I took the case to the hospital ethics committee with lots of wise pediatricians, intensive care doctors, a mom of a cancer patient, who hospital chaplains, and they heard the case and they heard about the parents' wishes, and they voted unanimously to oppose parents' wishes. And so I took the baby off the ventilator, and the parents and I allowed this little guy, this little darling, their much wanted little boy, to die of his extreme prematurity. That was their right. That was their decision. And as their baby's physician, I wanted to be there with them. If I couldn't heal him, I could at least be there with him as he departed. And, you know, I've done that forever. Anytime I lose a baby, if I'm in the unit, I sit there with the parents.
That's amazing.
Support them.
Susan, thank you for sharing that. I can tell by just the expression on your face that each time that those memories, they are difficult memories to share. There's a silver lining. And I said up front on the show that I was a premature baby. I think it might have been 8 weeks or so. It wasn't certainly as long or preterm as some of the stories. But everybody, this book is amazing. The book Susan's talking about is So Many Babies, My Life Balancing a Busy Medical Career and Motherhood. And I got to tell you, Susan, that one of the things that I honor you, and this book changed my life in one way, is that I was a premature baby, yes, but I never really stopped to think about what that meant or what really went on in the hospitals, in those areas where you did this amazing work. I'm just going to read one more little story here, just because I really want to drill down and make sure get the audience to feel this. This was the first experience informing death to parents. I'm just going to read this out. Her baby presented with full-blown Group B strep septic shock. And by the way, everybody, all these terms and things, I learned a lot medically about premature babies. It was fascinating. We resuscitated him one Saturday morning, placed him on a ventilator, gave him the fluids and medicines he needed, and hoped for the best. As usual, his infection was so overwhelming that our intensive care techniques made little difference. And tragically, this nurse's baby died the next day. This was my first experience of informing parents of their baby's death. I'll never forget sitting in a mom's hospital room, giving her and her husband the horrible news as all three of us cried. My goodness. How do you prepare yourself? I know you've done this for a long time, but how does one prepare themselves for that?
What I've always physician is talk to parents in a way that I want to be talked to. I always imagined that the things that were happening to babies could happen to my own child. And I just let them experience either the joy of recovery or the pain of loss and death. I think it's the healthiest way to be a physician, to be with the people that you are healing or not healing in the case of a dying baby.
Thank you, Susan, for sharing that. It's interesting because everybody, I'm just referring to notes. So a little tip to those who read books, if you read it on something like a Kindle reader, the digital copy is what I actually bought and have read, Susan, you can actually highlight things and then print it out. So I have a ton of notes here I've taken from this fascinating book. And so we're going real and deep here. I want to honor one more thing you just said about this could be your own child. Apparently you had a child, David, and it was unexpected and he was premature, right? So tell us about that.
I went into preterm labor at 24 weeks. So this was 1984. And 24 weekers didn't do very well. I was in the hospital for 3 weeks, terrified, absolutely terrified that I would be a mom of a tiny preemie in the NICU. Thank God, with antenatal steroids, which lots of moms get, and with good care for me, I did not have a baby at that stage. I was in the hospital for 3 weeks. I went home for another 6 weeks, and we had him 1 month early, not 3 months early. And he was fine. And he's still fine to this day. He's a feisty cinematographer. But
oh my
goodness. What Tom, the experience was that I felt so helpless in that bed, in that hospital as a mom, fixing to have a premature baby. I was terrified. I was helpless. I was scared to death. That experience helped me be able to talk to the moms and say, I know you're terrified. I know what this feels like. I've been there. And it would sometimes, you could see their shoulders soften. It would go, really? You understand? And I would go, yes, this is horrible. This is scary. Let's talk about this. Let's make sure you understand what's going to happen when your baby's born. And it really helped much to be a better doctor, having gone through that experience of being a patient mother.
No, thank you for sharing that, everybody. That's a teaching moment on the show. I mean, Susan had to go through this fear of having her own premature baby. They say, Susan, that when you're in rapport, it means that, very quickly the other person says, you know what, she's just like me. And I think it's a gift. Sometimes God puts us into situations and we learn later what the reason for that was. So that's really amazing. I want to go back to what I said up front, and I always be vulnerable on the show so people know I'm real, that I never forget it. My wife and I, Anna's Italian, wonderful woman, and when we were married 26 years ago, she had 2 children, 9 and 12, and of course I was young, 10 years younger than Anna, and didn't have kids, and I thought, boy, I want a kid. So we had our first, and I was super excited, and it was supposed to be little Tommy, and we lost him. Unfortunately, widespread Down syndrome. And I never forget, this is where your book really hit home for me. I always thought about what was me, what we went through. I never really thought about what the people in the hospital went through. I'll just tell you this and then give it back to you, that my wife was working in an office as a bank manager. I was working in another office as an exec. And we both got the phone call to go to Children's Hospital. And we drove separate cars there. And you just always know when you get a call to come in, there's more to this, right? And I never forget, but when we walked into Children's Hospital, looking back now, the way they treated us made it so much easier. But it still didn't minimize the fact when they told us the results and showed us the ultrasounds and the pictures. And I just never forget, from there, they rushed us out and then they prepared for a procedure. And, we grieved. It took time. And within a year, the miracle of my daughter came. And, looking back, I still, if I turn my head here, I have this little urn on the ground with Tommy's little bracelet and things. But I think we'll dedicate this show to all the healthy babies that you and your team saved, but all the ones we lost. And Thank you for the work that you're doing. There's a line in the title of your book. Hold it up again. We want to see that book cover. I'm going to just full screen you there. There it is. So many babies. Read the bottom, the tagline to that. This is My Life. Can you read that out?
My life, balancing a busy medical career and motherhood. Can you see that there's a stethoscope around the mother-baby silhouette?
Yeah, I see that now. I'm glad you explained it, because I'm pretty detail-oriented, but I didn't get that.
Yeah, it is the mother-baby silhouette, because that signifies everything I've done for 35 years. And the stethoscope around it makes a heart. And it's because the stethoscope was really the tool of my trade. My life, balancing a careerhood. I had 3 children of my own, and I was scared every step of the way that they would have an infection or an injury or some condition that limited their life. And I remember my husband saying, you just have to move on. You just have to not be scared and just hope that they're healthy and move on. And I think I was able to convince myself, because my husband is so good-natured, that it was not very likely that my kids were going to need critical care. And after David turned out to be fine and not a sick premature baby, I relaxed somewhat. The NICU moms used to say to me, Tom, "Oh, you're a doctor. You must have perfect children. Your life is so in order. Everything is wonderful. You have a helper at home." And I would go, "Are you kidding me? My life is not wonderful.
Yeah.
My kids mess up. I struggle just like you do." And they would go, "You do?" And so what I wanted, the stories in the book, the stories about my being a mom, I wanted those stories to speak to regular moms.
Yeah.
Because they would tell me that they couldn't believe I struggled when the kid was sick. Who was going to go to the pediatrician? How would I not go to work? That I struggled when the teacher called, "Got to talk to you about your son because he just threw a pencil at someone." And they would lighten up to hear that a physician, that their baby's physician, was admitting to being imperfect. It was so rewarding.
I'm chuckling, not laughing at you, but with you, because when you said that these parents were talking, and I went, "No, read her book and you'll get the real truth." And having raised two teenagers, stepsons to their maturity, and then a daughter who's now 22, I think every family looks back and you can see, and by the way, when we look back at our own lives growing up, we look at ourselves, you see all the train wrecks, you see all the things. It's part of growing up. Everybody, I'm not going to steal the thunder, but you've had some children, I think David and Anne. And was
David, Anne, and Laura. Yes.
I mean, but the laundry list is there. There's night terrors. There's throwing pencils and biting in school. There's, anxiety and depression, and, maybe a little bit of self-worth issues and pressure. All of this. One of the things that I remarked in your book, and maybe you can talk about this as a teaching moment on balance, we take it for granted. Some couples do that, you have children. Sometimes one doesn't work, but in today's world, I live in a part of the world, Susan, Vancouver, where you have to have $1 million to even afford a home. And so the next generation, the couple works. I grew up as a professional, being a CEO, and my wife is a banker, and we were both having to juggle. And this really resonated. But then I thought about the added complication of your husband's a doctor, I believe, or professional.
He's pediatric nephrology.
And I was reading in the book, and it really blew my mind, some of the comments about how things had happened with the children. And, I think I read somewhere in one of the chapters the words, the first time we were like ships passing
in the night.
in the night. And then, I even, I'm just going to quote this. It goes ahead in the book a little bit, but it says, "Deliverance. You moved to Austin, Texas." And I wrote down in the margin, "Saved marriage." And you wrote, "After 6 years of living and working in Little Rock, my husband and I decided to save our marriage and move to Austin, Texas." So the pressures of being professionals, one thing, but when you talk about all those stories in the book about what you saw and coming home with your own emotions, it started to seep out into the book. And this is where I want to honor you. I love you and your story, that you became very vulnerable and real to me, because there are a couple of times where you talked about how, maybe you yelled at your children because you're under this stress. And there was a real emotional moment for me when I read this. And I'm just going to read this and then give it back to you. This is I called this the first experience. Sorry, the slap. Something's wrong. And I'm just going to jump into the paragraph, page 44 of the book. It was something me to admit that I found myself slapping his little legs hard over and over again. I was horrified. I felt as if I had entered a dream. Somehow I was able to go outside of myself and see what I was doing. I was slapping my helpless, beloved little boy. This moment was so terrifying for me. I'll never forget it. I put red marks, handprints on his little legs. My old childhood tapes had taken over, playing in my brain. Fortunately, I recognized immediately that I was hurting him, stopped slapping him, grabbed and hugged him. By then, both of us were crying. Oh, my goodness. Now, just so we don't beat up on you too much, there are so many parents. I was raised, like you said in your book, by a father and a mom who hit with the belt, and we got the wooden spoon. This was a case of, you just having this emotional moment. Tell us about that.
My father was very strict, very authoritative, an old military man, a survivor. He had a lot of reasons to be full of rage. But he hit us and slapped us and pulled my hair and hit us with a belt and yelled unmercifully at us. And I know lots of people grow up with parents who yell, hopefully not parents who hit. and I didn't realize all that had been stuffed down until I had children. And the time that I found myself slapping my son, I had been up for 24 hours. It was a difficult shift. I came home. My husband was headed out the door to go into work, and I was so exhausted. I was just empty when that event happened. But it happened, and it let me know I had to do something to not be like my father. I had to do something to control myself physically, to control myself emotionally. I was not going to do that to my children. And I started in psychotherapy, and I have been in psychotherapy on and off my whole career because I did not want to injure my children in the way that I felt I had been injured by my father. And I had stuffed it down for so long, I guess I didn't realize that all that rage could come out, or physical abuse could come out if I was stressed and exhausted. And so I worked on it. I really did. And I think people who are raised up in the wrong way need to admit that. And it's okay to admit that, because many of us were yelled at as kids. Many of us were unloved as children.
Yeah. Listen, thank you, everybody. This is a teaching moment. You're really getting to a level in my heart here. I'm going to share a little bit more with you. I was going to play this little video a little later, but here it goes. We're going to give you a fireworks display there for what an incredible piece of vulnerability and teaching moment. And so I've told you that I've written a book, and I'm, at some point I'd like you to read part of it. It's about my life growing up, but you may not know, but my life, my father was a commanding officer in the British forces. He was born in Fiji, but we came to Canada and he stayed in that. But he also became a very bad alcoholic, and he was violent when he drank. I have two brothers, but I used to tell my BS story and say, woe is me. But I would say I was a black and blue baby. So you kind of get a picture. Ooh. My parents divorced. My mom was very depressed all the time, and my dad had affairs, things like that. I saw things in my childhood I can never really explain. And I changed the meaning of my father. In my book, I said my dad's demons became gifts. And what I realized, Susan, through my own healing, is that we have a choice. We can attach a different meaning. But 3 years ago, I fell in a bathtub and had a serious brain injury, a concussion. That's another chapter in my life that I did a TED Talk on it in February 2020. People can know that story. And it sent me into depression and had my first suicidal thoughts, and really my life stopped. But it forced me to, for the first time, seek help. And I've been with a psychiatrist for 2 years, and I did cognitive behavioral therapy, which I read about in your book, which just, I went, yay, there's somebody out there to get me. And what I'm just going to play back on you, because it really honors your story, that everybody, what I learned, and Susan can talk about it, is that most of what is put in us is a kernel of truth. And up to about age 15 or so, when the prefrontal cortex isn't working, everything goes in and is logged in our neural nets as thoughts that are true. So if somebody says you're fat, you're ugly, which was my case, or got hit by a dad. And when I did my TED Talk, Susan, I said something like I was a self-worth chaser. They called me a high achiever because I was winning awards, but enough wasn't enough. And I climbed to CEO at 31 and then kept looking and seeking. And what I really discovered later in life is that I was really seeking the love from my father that I never had. But my brain, every time I was in a room with somebody, my brain always felt not good enough, not loved, which goes back to, but here's the thing, my dad was so violent that at times in my life, when you wrote about that, I said, my goodness, for you to have that self-control, to recognize and stop yourself. This is a part of the show I want everybody to know, because you and I have the same thread. I have the same self-control, but it could have gone the other way. I could have hurt the people in my life. And I guess why I'm taking a little bit extra time on this is I know so many people out there who, unfortunately, they hurt the people in their lives, hurt people. And so everybody, I just want to honor you, Susan, publicly, that reading this book, it shows courage for somebody like you as a professional coming out and talking about that. Everybody read, but take a different approach. So I want to get back into the story a little bit. I read on chapter 4 that I wrote the dad story, and I did read that about your dad's upbringing and things. And the last part I want to share with you, Susan, is when my dad died 3 years ago, I connected and had coffee with him, and I actually was estranged from him for most of my life. And he was in AA for 22 years when he, and we were supposed to have coffee every month after, but he died unexpectedly. But I became free. But I remember saying to him, tell me about your father. And my granddad I never met. And that's when I learned about how he grew up, and his dad was an alcoholic and the pain he had.
Yes.
So everybody, I just want to say, Susan, that I learned through my whole experience that many of us, we're not really who we think we are, and we're seeking for the truth, and we're really somebody we're not. So let's go back into your story. So here you are, and you're in this career, and all of a sudden things started changing, and you started experiencing some personal signs of what you wrote as burnout, depression, just from balancing all that pressure of the career and raising family. What was the beginning of that for you?
The first point at which I realized that I was overwhelmed was actually what people called postpartum depression. It was after the birth of my third child. I had turned 40. We had moved to a new city. My husband had a wonderful job as division chief and vice chair of the department. And I had a job just sort of being an everyday neonatologist, but it was way too much work, way too much call. I took a month or two to find, we found the right house. We found the right schools. We lived in a great little neighborhood. I got to know people and new teachers. And I thought I was ready to be settled in, but with 3 small children, breastfeeding my young and working busy schedule, probably 50, 60 hours a week, taking night call twice a week, I went over the edge and I became depressed. I became very depressed. I can't believe that I was able to work during that time, but a friend of mine who was also a critical care doctor said, I think you're depressed. Of course, my husband noticed it. And I sought therapy then, And I had another good psychiatrist who said, you know, what's going on here? I described to him that I was like the guy on the Ed Sullivan show who twerks and spins plates on a stick. And I was on stage and there were all these plates. And I was rushing around, spinning plates, trying not to let anything break. Nothing could fall. I had to keep everything going. All 3 children, husband, job, friends, work, this project, this project. And he looked at me and he chuckled. I was going, what the heck? Why are you chuckling? He said, take down some plates. And I went, what? And that is exactly what he helped me do. I started examining all the priorities in my life, and I took down the ones that were not important. And I continued to spend the ones that meant the most to me. It was a miracle. I mean, this man, that metaphor must have touched him, and it retouched me in a way that I finally got what my issue was. I was doing too much. I was trying to prove myself. I was trying to be good enough as a mother, as a doctor, as a friend, as a wife. And I injured myself in that process. And he helped me unload some of those things in which I was struggling with myself. Like you said, to prove my self-worth.
Yeah.
And when I decided to focus on the things that matter to me, I got better.
Oh, that's amazing. Thank you. And everybody, when you do get this book, and by the way, I'm just going to do a plug here. Authors work, you know, we write books, we're not known, but the way we get known is we ask you to get the book, but also read it, write a review, post it on goodreads.com, amazon.com, wherever you buy the book. That's how we get known. And Susan, this is such a deep part of the story. And again, honoring you for your vulnerability, but there, this, you know, I say hiding in the shadows. When I was, as an executive myself, I was hiding in the shadows at the top, running companies with anxiety, worry, sometimes depression, because it's lonely at the top. There's nowhere to turn. And somebody explained it to me this way, and I just want to, you know, visualize a 1-ton red truck. You know, my father-in-law, being Italian, grew up herding sheep on the mountainside in World War II, my wife tells me, and he had this red truck, you know, one of these old 50s Chevys. But our brains are like a 1-ton truck, and unfortunately, when we're born and as we go out into school and then careers, the capacity is only so much. And then we have children, and then we have high pressure careers. And of course, I want to just read something here that you wrote in your book, page 95 from the Kindle. Hyper responsibility and tendency towards perfectionism set me up for continuing disappointments in my new job. Looking back now, I must have made up my mind to not like it there. I was trying to stay afloat professionally and failed to realize how to help my children. Clearly, my sense of balance between medicine and motherhood was unstable. Everybody, when you read this book, you're going to see so many other sides to this story that we haven't mentioned. For example, you started the milk bank. You and your team established some procedures that actually saved more infants. This is a lady who has accolades and experiences, award-winning, many of them could be. But here's the thing, going through life feeling I'm not enough because of the way your brain was programmed led you down that dark path to keep seeking and keep climbing until you hit the wall with that depression. It was interesting when you said about the depression and going through the therapy and the plates. I think that's a great metaphor, and I'm gonna steal that from you and use that. And one of the things I saw that through that procedure of actually healing, you took what I call a side hustle. You took a job at a lower level, right? So maybe you can tell us about that. I think that I call that the turning point, where all of a sudden you didn't need to be this high paced at this level. You finally realize I can be enough, and I can go in and do something at a little bit easier pace. Tell us about that. What did you do?
Well, we were talking, I was still trying, and I were working through our issues, and the kids were acclimated fine, and I was still so unhappy with clinical work. and I didn't fit into the group in which I was working. And I had an opportunity to go to work as a medical director for an HMO. It was the med school's HMO, health maintenance organization. And I thought, oh, this will be great. I'll be a physician executive. I'll be able to make all these big decisions and money and finances. And I took the job, and I did that for 2 years. I got quite a bit of training as a physician leader, executive leader. And I really felt like I was on the wrong side of the fence, so to speak. I really felt like my heart was being a doctor, being a healer and a helper. My heart was not in, and telling people it costs too much and saying, well, we really can't do that. You got to follow this exact guideline. And so we decided, that was my side hustle, being a medical director of an HMO, but we decided to change everything and move to Austin. And we both got brand new jobs. We both left academic medicine and went into private practice. And both of us had very successful careers from then on. Working in private practice, my husband organized a specialty pediatric group and helped found and create Dell Children's Medical Center. I joined a neonatology group with 9 men. That's a whole nother story. I was the only female in an all-male group. And Austin turned out to be a perfect place for us. Now, there were ups and downs with the children and new schools and whatnot. But it was the place. Both of us had the professional ability to be ourselves, to not feel like we were a misfit. And so I really my husband deserves a lot of credit, because he is so calm and so flexible that he was willing to make a change so that our family could be healthy and our marriage could be healthy. I just implore professionals to try to work through whatever is going on when they get imbalanced. We all go through time balance. Somebody's doing more work, somebody's more stressed, and we've got to recognize those times and work as a couple and be parents as a couple and share our fears and our concerns. And that's what we did. And we made it through. We've been married for 38 years.
Yay, another fireworks. 26 here coming up. So we got a few more years. You're obviously mentors for people like us. One of the things I wanted to just acknowledge, everybody, teaching moments galore there, that this is almost like I wrote these notes down on my paper here, that there's like a full circle. And, it's funny, Susan, because I studied a lot of the narrative behind the hero's journey by Joseph Campbell. That's really the background of my show. And it's a mirror to my own career. It's almost like, all right, I'm not saying your story is mine, but we're connected by a thread in our stories. That's what Campbell says. And the threads in yours are raised by a militaristic taskmaster father who did love you, but he drove you. The attention you got was when you achieved and when you did these things, went into life and was programmed that achievement is the way to feel good. Continue to achieve and achieve and achieve, really not realizing or thinking you're good enough, overachieve, burn out, come back down. But you had the ability to go and get some help to sort through that. And I think what I admire about you and your husband is, in my book, I wrote a line, 90 days or live the life that you deserve and desire. That when I was at that top level, traveling all the time, orphaning my daughter for 5 years, being on an airplane, and I had a good paycheck and we had a great lifestyle. But part of me got to that point where I'm saying, like, why am I doing this? I'm not happy. And I believe, and you can correct me if you differ, that sometimes we place ourselves, it's our choice in the situations to please somebody else, not for who we really are. I know many people like you who have all of a sudden shifted their careers and they're extremely happy with the shift, what they've created, but they've created it so they can have a life that they want, a healthier life. So I'm going to give it back to you and just ask you to comment on that last piece about, here you are, and you made this complete life change. And how is life today? having been through now on the other side.
When we made that life change, we moved to a city that fit our personalities better. We're a little liberal. We love politics. We love UT. Austin's a real outdoorsy, exercise, biking kind of town, and we love the air. We were so happy to get our kids back in public schools. We were both graduates of public school education. Yeah. But when I moved into this private practice, the first few years I was adjusting to working with all men. They ultimately hired quite a number of other women neonatologists. And I talked about how I sort of brought them into the way of thinking about families. But they were all good husbands and fathers. They just had wives that stayed at home and took care of them. So it took them a while to understand what working mothers needed at work.
Yeah.
Anyway, I was challenged by falling in love with something, and that was breastfeeding medicine and human milk banking. And the Austin Mother's Milk Bank had been started by 2 neonatologists 6 months before I arrived, and they hired me to be the medical director of the milk bank. And I went, okay, I don't know anything about that, but I love it. Let's do it. And so I served as a medical, and I learned all of this information about human donor milk. We did research projects. I presented those at meetings, and I became an expert in an area that I love, breastfeeding medicine. I always helped the moms in the NICU that were struggling with breastfeeding. And there's no worse place on the planet to try to breastfeed than in a NICU, because your baby is sick and you can't pick them up and hold them, and you need help. But anyway, and so I felt like I had this whole new career. I was still a neonatologist. I still took care of sick babies in a NICU, but now I was doing research and writing papers, and I'm still academic, even though I was in private practice. And I had this whole new area of expertise, and it was so fulfilling. But I knew that I could get in trouble too far with it. So I tampered what I did. I held myself back. I didn't go full throttle. I even turned down a leadership position at the AAP for just that reason. I did not want to get consumed again. But I loved doing something different that really spoke to me. And I think a lot of people are right now struggling at work. I know working mothers are, and they're feeling like they could do something, and they're not certain about that.
Yeah, I went on a journey in my mind as you were saying that. My wife told me, well, a long time ago, because when she got into banking, it was a male-dominated career. And I remember she said, she was being interviewed by this fella, and he said, so, what's going to happen when, somebody has to change the diaper of the baby at home? And Hannah's very strong. She said, well, I guess if my husband's home, he'll have to deal with it.
Right.
But we don't think about that. And I do a lot about the impact or parenting. And I also realize that when, I guess it's still an uneven playing field. And,
it is.
Men still, we need to have more women in leadership. Yes, men still have a lot to learn. And I'm going to say this and get in trouble, but it's really what I believe. Moms and dads, stop raising boys who live their lives as children. We let them play video games, and we let them do this. They don't clean the dinner table, and they go into life. And I hear so many stories, because I do coaching, that, well, he comes home from work and he's playing sports or he's video games. So, well, does he clean the house? Does he do chores? Does he help with the children? We need to prepare our men differently, and men, we need to take responsibility. I unfortunately grew up with no sisters and lost my family at age 12. That fell apart. I mean, I went into life realizing it's my responsibility to grow up and be a man. Now I'm going to get off my soapbox, because I know I'm going to take some for saying that, but I truly believe that, we need to do better. And so I want to just finish with a couple things and give it back to you for any thoughts on that. I have a couple more really important notes I wanted to have come out in the show. One was, I made a note here, talking at the dinner table watch what you say. And this made me smile. And I think one of your daughters blurted out, "Why do you want to be a doctor and care for babies if you want them to die?" And I think that came from something before that you apparently used to talk at the dinner table about things. Tell us about that.
My husband and I, he's a pediatric nephrologist. He would dialyze children with chronic kidney failure.
Yeah.
And we would come home and we would de-stress by telling each other stories of the day. And I had one particularly difficult case. A little boy born at 450 grams. He was growth retarded. Mother had severe high blood pressure.
Wow.
And he had a terrible chronic course in the NICU. He developed many complications. Finally went into liver failure. He had developed a clot in his heart. It just was one awful thing after another that happened to him, because babies that are that stressed in utero really have a hard time adjusting to life outside. But I had a hard time reaching his mother, and I thought the baby should be allowed to receive comfort care. He was terminal. Everybody knew he was terminal. He was dying.
Yeah.
And I couldn't reach this mom, and nobody could, not the nurses, not the social worker, nobody. And I was very frustrated because I thought this child was suffering. I thought this baby was really suffering and not being allowed to die. And I made that particular comment at dinner, and Laura said, "What in the world? Why do you want your patients to die?" She was kind of a, snarky teenager at the time, but I said, I want him to live. That's what I do for a living. I heal babies and I help babies. I took her up to the NICU. I showed her all the babies around the NICU. I introduced her to all the moms, all the nurses. Some of the babies we picked up and held. And then she understood. What I did was help and heal the babies that could be helped and healed, and talk to the moms who loved their babies and who wanted what was best for their baby. But this particular mom, I couldn't reach her. That poor child lived 6 months. The last 3 months of his life, he suffered quite a bit. He finally died in his mother's arms. And she said to me, "Thank you, Dr. Landers, for everything you've done." And she left. And I still think I never reached that mom. And I felt somehow like I had failed her.
Yeah.
Not the baby, but her. So the example is, watch what you say at the dinner. Your children are listening. Your children do need to do for a living. It's very important that our children know what we do when we leave the house and go to work. They need to know how we contribute and whether or not we're good at what we do. And a lot of working moms are struggling with this right now. My kids have no idea what I do. It's so hard, and I come home and I'm exhausted. So the caution for working mothers is, don't overstress, don't overwork yourself, but be honest with your kids and tell them what you do.
Yes.
And explain to them your stresses and how mommy gets frazzled and how mom loses it. And I was really fortunate, Tom, very even keel. He would always pull back and calm down if ever I was revved up. And I wanted to say another word about balance. Working moms nowadays feel so out of balance. They feel like they're doing everything. All the childcare, all the remote learning, all the housework, all the cooking and working, and it's going on and on and on, and they're so stressed. My husband did all the grocery shopping and all the cooking because he was good at it. And I did everything else, all the teachers, all the coaches, all the parties, all the play dates, all the costumes, and on, all the stuff to keep our kids happy and have their own little extracurricular lives. And our deal worked for us. And a couple has to make a deal. The working mom cannot do it all. The working mom has got to have a working dad that helps out.
Totally. And I think those are conversations, you know, as in preparing for marriage, those are conversations that need to be had. What's your husband's first name?
Philip.
Yeah. Well, Philip, if you're out there, it sounds like I'm brother from another mother here. So just so you know that, you know, and I wonder why this book stuck to me. And sometimes I believe the universe, when people are sent to me, I can tell God's got a plan and we need to be on this connected to these people. I'm a home cook. I've watched cooking shows. I escaped actually the horror in my home by baking and cooking, but I do all the shopping, all the cooking. That's exactly what my household is.
Oh my goodness, that's wonderful. Yeah.
And I used to leave my board meetings or executive meetings a long time ago when I was at that level of a public company to go to Costco, pick up some stuff and cook. And I tell some of the guys that, and it'd be like shameful. They're like, "Are you kidding? Why would you do that? How come you're?" And I said, "Hey, dude, I'm you know what? I'm happy. That's my love language is cooking. That is exactly it." And
preparing food for your family.
Tell Philip to find the Quiet Warrior Instagram page. You'll see all my creations because I do plate looks and I basically take stories. Like I would take this story and I would in my mind create visually a 3-course meal and then I go shop and cook it. That's what I love to do.
Oh, neat.
I want to make a couple more comments about what you said about the dinner table. Everybody, this is such a teaching moment from Susan. You need to get this. Our brains are wired for the negative. You know, the sympathetic nervous system, I learned, is you look for danger, not for joy and happiness. So what do? We come home and we sit and we bitch and complain about our jobs because it all builds up. I grew up only hearing at the dinner tables until my parents split all the things that were wrong with careers. And I remember my mom and dad would be screaming and yelling or arguing or talking about adult stuff. And I hear my mom say, "Oh, the boys," because if there were 3 of us, she'd say things like, "Ah, the boys won't understand." Yes, we will. And later in life, and this is the important thing about what that meant to me is if we sit at the table and we're talking about things, the children's brains takes it all in. There's no filter and wires it as truth. So if mom says, you know, she's trying to put a baby out of their misery and take them to have, she doesn't want to, she's trying not to take, they don't have rational use of the brain. So the brain's like, I'm confused. Mom apparently goes to work to save babies, but she's saying how this. And so what we need to do, everybody, is we need to really balance that. And thank you for giving that gift in your book. I remember later in life, Susan, the biggest root of most of my pain and trauma were things that started coming out later in life that were wired into my thought patterns that my parents said that I thought were true, but they weren't. And there's a lifelong of therapy to unravel that if you come from some of the things that we do. So thank you for that. The last one, and this is really, and then we're going to honor you with some awards. This one really hit home and it was fun. It's out of the Good Enough Mother, chapter 19. And I'm just going to read you something here. And I'm going to ask you to answer the second part. It says, I was a bad mother. It took me nearly 3 years of therapy to learn that was my part in her struggles. And so in other words, here you are feeling that you underserved and you weren't a good mom. And then somebody asked you a question. The question was, are you the way you are because of your mother? So to help us understand it, because it's such a big learning point.
Oh, this was so huge for me. My 3rd child was going through a very difficult teenage experience, very rebellious. Oh, just skipped school, wrecked cars, got tattoos. She was awful. And I felt like it was all my fault. What had I done? And I actually slapped her. I lost it. And we were having a fight and I slapped her. And that's when I went back into therapy. That was 2008, 7 or 8.
Yeah.
And I was working. So I'm a bad mother. It's all my fault. My kids are messed up because of me. This one particularly, somehow I screwed her up. The psychiatrist said to me, are you the way you are because of your mother? And I thought, and I said, no, I'm the because of what I do and what I believe in and my values and my friendships and my marriage and my work. And she said, well, then why do you think you are the cause of the way your children are? And I went, whoa, whoa, you're right. That my children are their own people.
Exactly. I
might
interviewed
hurt them, but I'm not the cause of who they are.
Thank you for sharing that. I wanted to make sure we captured it. I interviewed a psychologist a few months ago, and she said a woman has only one job, or my mother had only one job, and that is to pop me out. And then after that, everything else that happens is not her doing. And this was this applies to men too, by the way, because I experienced a lot of guilt and some shame, feeling I underserved my own daughter in parenting her, and guilt and blah, blah, blah. But this is a really important point, everybody. You are good enough. Susan was born golden. She's good enough. She did the best she could with what she had. And if your children become train wrecks, the good news is this too shall pass, but it's not your fault. You did all you could, and they have to look after themselves. So now we're going to have some fun and honor you as we wrap this up here. I've been waiting for this. So I'm going to full screen you. Show us the book again. All right. There it is. So many babies. My life balancing a
there we go.
Medical, yeah, perfect. My life balancing a busy medical career in motherhood, Susan Landers, MD. All right, that's great. So now we're going to show you, I'm going to surprise you here. So we're officially launching your book review. So it's going to cover us up for a minute. I'm just going to post it here. All right, there it is. I've written this review. And people can go
roller coaster ride.
People can, I won't read it out in detail, but it'll be in the final production of the show. Everybody, I've given it a 5-star. It's an amazing book. You need to get it and read it. You'll find this on the Amazon. It was posted December 5th, and we're going to do some fireworks for an author who's brought everything into a book that I think has the potential to change the world. So congratulations on hang on, let me get rid of that. It doesn't want to go away. It's so excited. There it is.
Just last night, a nurse friend of mine said, I'm just curious. She said, look, I love your book, but I just want to know why were you so honest about everything? I said, I just figure there's a lot to be learned in this kind of life, and being honest is the only way to get it. Right. And understand it. And she said, oh, okay. I said, I don't have anything to lose. I'm retired. Help other people.
Here's the thing I want to say to that person, and it's a positive that I'll be honest with you, Susan. It took me a long time as a leader to learn this, that most people don't want to be vulnerable. They think it's a weakness. And most people have egos. I say, check your ego at the door before you come on my show. And you wouldn't believe how many people I turn away from my show because they show up talking about how great they are and all their awards and what they achieved. And I'm looking at them going like, that's a bunch of BS. There's no way that life is a straight line. And here's the part of my response to that wonderful comment, because it's inspiring to talk to, that when I look at somebody like Susan and I see the truth, she's real, I believe her, and I'm inspired, and I want to take action and follow her. And so that's the difference. So for all those doctors out there in the shadows who maybe feel, geez, if I tell the truth, they're going to think I'm weak. Actually, if you tell the truth or you become vulnerable, it's a strength. And in the business world, especially if you teach CEOs at the top of business how to lead their teams, all of a sudden people go, oh my God, where'd that guy come from or that gal? Now I can maybe follow them because they're stopping the BS, because life's really not like that.
Right.
We're going to
Good for you.
And so now we're going to induct you into the Hall of Quiet Warrior Tribe. By the way, this was the proof from Amazon. There's the review posted. This is your first international Canadian review from what I can see.
Oh, yeah.
So you'll see it at amazon.ca. That's where you'll find it. So I'm going to full screen me for a minute as we wrap this. So you see in the background there, Susan, there's an image on my screensaver.
Purpose, action, life.
So that's what's called a challenge coin, and you might know about these. But challenge coins were created in World War II, and they were carried by soldiers in their pockets. Today, they're used around the world by first responders, people in medical communities. Alcoholics Anonymous has their own version of a coin. And these coins were carried to commit community. So, for example, if you showed up without yours, maybe you'd buy dinner or we'd buy drinks. I wanted something for the show that would be connecting us for life. And the people coming to the show are quiet warriors. They quietly go on their way with purpose and taking action to change life with their stories. So you'll be receiving this coin. The front of it is the image of the show. The back is the hero's journey narrative, crafted and painted. They're handcrafted and raised and all that. So welcome to the tribe. We now have, in I think, 17 countries, these are being carried. So
thank you so much. What an honor. Love it.
Thank you. Thank you for being part of this. And I look forward to staying in touch. And, we are honoring you as we wrap up here for all the things that you have done to save so many lives and the wisdom that you shared with us. So thank you for being on the show.
Oh, thanks, Tom. This has been so much fun to talk to you. I love it. I love it.
Thank you. And so everybody, find that true passion like you see from Susan. Live life with purpose. And hey, live the life that you deserve and desire.
Thank you for listening to The Quiet Warrior Show. Create is a motive-based leadership development firm. www.kreat.ca